Are you ready? The Pap Attack.
The United States is one of only 2 countries in the world that allows drug companies to market their products directly to consumers. For the last 18 years, our TV airways have been dominated by commercials telling us that if we feel sad, if we feel sick, if we feel anything at all, then we probably need to take a magic pill from Big Pharma to make all those worries melt away. And by the way, that's a magic pill that's been marked up by as much as 20,000% in some situations. Direct-to-consumer advertising has been a huge cash cow for the drug industry. Drug companies in the U.S. are now pulling in around $300 billion every year, and this massive haul is all thanks to marketing. 20% of the country now takes at least 5 prescription drugs per month. Every $1 that Big Pharma spends on TV advertising, they get a $4 return. Sales have increased by almost 15% since that kind of advertising became legal. Direct-to-consumer advertising has turned us into a nation of hypochondriacs, and that's what Big Pharma wanted. Every time we turn on our TV, we see a soothing voice telling us that we may have depression or bipolar disorder or acid reflux or restless legs, insomnia, or just discomfort. And Big Pharma is right there at the cash register waiting to hand us the cure. The result is that doctors have now become order takers rather than objective thinkers. Patients walk into a doctor's office with a list of demands, and some drug companies even provide a list of talking points on their website for patients to bring into the office to make sure that they walk out with that blockbuster drug. But the golden age of Big Pharma might be coming to an end. The American Medical Association has had enough of Big Pharma's greed, and they're now lobbying the government to please ban direct-to-consumer ads because the only groups that are benefiting are the drug companies. The AMA understands that direct-to-consumer advertising is a disaster. It's a train wreck. It puts unnecessary medication into the hands of people who don't need it, which is a recipe for disaster. The AMA wants to give the power of prescription back to the doctors, the people who spend 8 years in college and 4 years in residency, the ones who understand how to diagnose a problem and take that power out of the hands of the damn drug company CEOs who really don't care about their products being dangerous. They only care about making a few more dollars. Because that's what medicine is about to Big Pharma, not about helping the sick, but about making as much money as they possibly can, giving drugs to people who really, really don't need them.